World-renowned heart surgeon Dr. Mehmet Oz takes on the most critical health concerns of our times. Discover the future of medicine from those who are making it, and become a world expert on your own body on Second Opinion.
Joining me again is Dr. McHenry Lee. He's also the author of the book, Nothing Personal, Doc, But I Hate Dentists. I have is teeth loss. And I know that there are a couple reasons why we can lose our teeth. Just walk me through that process.
It's really quite simple. There are three ways, and two of them are infections and one is mechanical. And the first way is the decay. And that's when you want to stop the decay right as it gets in that little valley, because teeth have a little valley in them and they're called fissures. And what you want to do is to be able to, as soon as that enamel decalcifies by the acid from the bacteria you showed previously, and you want to prevent it from getting down into the dentin, because once it gets into the dentin turns brown, it becomes infected, and the bacteria and the infection make a beeline towards the nerve, and that's when you have to have the root canals and everything, or tooth loss.
What else causes tooth
gum
loss?
Disease, as you said. You know, probably 70% of people lose their teeth to gum disease, and it starts out at gingivitis, and then it can go to trench mouth.
What is trench mouth?
Trench mouth has all kinds of names, and one of them is pyorrhea, another one's called ANUG, acute necrotizing ulcerative gingivitis. That's the biggest word I'll use today. and it really came about in World War I when the soldiers were in the trenches. And so we talked earlier that gum disease is communicable. In other words, you can get it from one person to the other. Also, gum disease has a lot to do with the immune system and stress. So here these guys is in the trenches of World War I, and they are stressed to the max. They're right there together. They're sharing their canteens. You know, they don't know whether they're going to live and die, and that's where the trench mouth developed. And all it is an explosion of bacteria on the gum tissue that causes an ulceration, and it's very painful.
Now, I understand why gum disease is a problem, but why do your teeth fall out from it?
Well, as gingivitis progresses down into the roots of the teeth and starts affecting the bone, it just eats away like Pac-Man, and it literally just eats out the bone around the teeth, and all of a sudden the teeth are loose.
And the third reason we lose our teeth?
The third reason is the wear. So you've talked about it with the three-legged stool and in the picture of the wear here. And in your case, you know, wear will be one of the most challenging problems for yourself.
From grinding your teeth?
Well, it's from you know, the way that your jaw is, and that's you.
Let's talk about the book, Nothing Personal, Doc, But I Hate Dentists. Why did you write that book?
Oh, well, we wrote the book because people are just not educated. I mean, only dentists know anything about dentistry, and that's worldwide. It's incredible what we can do today with cosmetics, with bonding, with lasers, with the braces, the new braces. It's such an exciting time, yet nobody knows this.
So how do you change that? How do you educate individuals to shift their perception of their teeth?
Well, I have my co-author and I, we thought about that a whole lot, the fact that dentistry had failed the public. And so we set out to educate the public, and the reason we named the book I Hate Dentists is because it makes people smile, just like you're smiling right now. And humor is a great stress reliever, and it's unfortunately in dentistry and stress seem to go together.
Let's talk about kids. How do you screen kids for cavities and other problems they may have with their mouth? I mean, they eat lots of candy, they always seem happy, they really hate dentists.
Well, they do, and most people do. Most people hate the dentist unless it's done properly. So the whole key is prevention. That's it. Now, prevention starts when the mother's pregnant, in the womb. At 5 weeks is when the tooth buds begin to develop. So the nutrition that we've been talking about is so important for the parent. Then they need to get that child at the dentist before that child has a problem, so that that child at a year old can relate to the visual stimulation of the office, to the sounds, to the smell, and relate it to a good experience.
This has been super informative. I'm Dr. Oz, thanking you for joining us for Second Opinion on your health. And remember that you can be a world expert on your body, and we can help. Take care.
Questions about your health? Ask Dr. Oz, only on Discovery.com. Coming up next on the World of Wild Discovery, examine the evolution of a species built to last as Discovery takes a closer look at the ancient mammal, the rhinoceros.